With analysis, Scott Flanders, the CEO of eHealth. Scott, what do you think? I mean, you probably weren't any fan of ObamaCare. What do you think of this plan?
Well, so Jerry's absolutely right. I mean, let's look at the track record of CBO. It's inherently difficult to project 10 years out. You know, 10 years ago today, no one had ever heard of an iPhone. The iPhone was released 10 years ago in June. And so, you know, the world changes very rapidly.
Sure.
Who's going to predict the stock market? So I think it's unfair to hold the CBO, who are high-integrity people, with
over 10 years, it generally does. But I hear you. In other words, the world changes, technology changes, and it's very hard to actually suggest what's going to. But there are some constants, right? And that's that if you create an environment that is so not hospitable to business, to these insurance companies, then they're going to do exactly what they have been doing, Scott. They're going to get out of there altogether, and that's what we have seen.
Well, so that's so well said. I mean, I think it doesn't get enough treatment here in the press, and it's frustrating, you know, as an eHealth CEO who talks to customers every single day, by the tens of the thousands every week. They have declared this legislation that it doesn't work for them. It's horrible for the middle class. It's horrible for job creators. ACA was well intended. The guaranteed issue, which is maintained by AHCA, has been a good thing, but almost every other aspect of ACA has failed. Insurers have lost hundreds of millions of dollars. They've left the market. The middle class have been priced out of the marketplace. Premiums have doubled. Deductibles have doubled. Effectively, people in the middle class, the working class, they are effectively self-insured.
You know, Scott, the big complaint by the CBO, or what people are citing in the CBO report, though, is that 23 million people will be uninsured, which is an increase. You know, you just have to also take the reality of the situation, which is that, I'll point out, you know, there will be more people that just opt out because they can. Anyway, I got to leave it there. Scott Flanders, good to have you here. We'll be right back.